The beauty for us, all of us now, is that we have such overwhelming clinical evidence and trials and studies that we can point people to, and ultimately they have to make up their own mind. Denise Scuteri-Brooks, who's just a delight to work with right now, and thank you for being on the call. I've been off my diabetic meds for 4 months and my numbers are fantastic. Does being off metformin also help detox the pancreas?
I would say yes, because, anything that you can, sort of not have to take to regulate your own insulin levels and do it in a more natural way, like with spirulina and Cerule products. I mean, that would be the best way to do it. And I've seen people who were, on metformin, those oral hypoglycemics as they're called, so they're not on insulin, and they've actually lost weight just from diet and exercise, and they're able to come off metformin, and reduce their blood sugar and their hemoglobin A1C. So imagine, like, if I was in that situation and I was told I should take metformin, which, okay, maybe I did for a while, I would be taking these products, and then the same thing I would be doing, like with my statin. I would be cutting back the metformin and just then repeat my blood sugars and repeat my hemoglobin A1C again every few months, and just see what the correlation is. And if you find that that's lowering as you're dropping your metformin, you may end up stopping the metformin and just being on these products. But that's how you could do it.
We're going to watch with an interest. I mean, people are going to be marking it in their calendar. Dr. Stan's going to give us his results in a couple of 2 or 3 months, did you say?
Sorry?
2 or 3 months before you do your test
3.
again. 3 months. So they'll be putting it in their calendar. They'll be on that webinar. A couple of other quick questions. Charles Key says, how does blood flow help with diabetes? And can PlasmaFlo work with the StemEnhance product?
Well, yeah, I mean, PlasmaFlo is, I've read all the ingredients in them. They're absolutely spectacular. I mean, there's so many unbelievable ingredients and molecules in PlasmaFlo to help with the flow of, obviously, blood in your organs. So anything that can stimulate your blood flow is going to be great for you just in general, because let's face it, blood flow is everything, right? Especially as a surgeon, we know that. If you don't have a good blood flow to tissue, you're not going to heal. That's how wound healing works. That's how everything works. How surgeries heal is blood flow. So that's the holy grail for surgery. So if you have a wound of any kind, whether it's from surgery or from trauma, whatever, you've got better blood flow, better oxygenation, you're going to heal better. So that's generally absolutely true.